Hi, my name is Arielle Creager, and today we will be talking about 8 common aches, pains, and complaints in pregnancy. The first one is low back pain. It's a common ache in the low spine due to shifts in posture, growing belly, muscle imbalances. Happens a lot because our center of gravity is shifting. We usually lean back a little bit to counteract it. All that pressure is going into the low back. To manage or prevent low back pain, often it's managing, you want to have neutral alignment, so that's ears over your shoulders, ribs, hips, knees, and ankles. And it's also important to strengthen your core and your glutes. Incorporate gentle stretches like cat-cow, kneeling hip flexor stretches, so these are your hip flexors. And I always encourage my clients to engage in regular movement and have supportive footwear. Very underrated supportive footwear. Avoid anti-extension core moves, so full plank, Supermans, which you're probably not going to be doing because that involves being on your belly, but anything really compresses the spine. A great example of this is a deadlift with too much of a load, too heavy of a weight. Just take it down until that low back pain goes away. Avoid flat shoes, avoid high heels, and avoid extended periods of sitting. Number 2, Diastasis Recti. It happens to 65 to 85% of women to varying degrees of severity. It is a separation of your abdominal muscles right at your midline, and you can see it, especially upon exertion, of a coning or a doming right here. And that is your cue to pause what you are doing, regress it, or just pause for the time being. What helps it? 360 breathing, pelvic floor activations. I have other videos about how to do those. And neutral posture, right? You want to keep your core in alignment, avoid behaviors that spike intra-abdominal pressure like breath holding, the Valsalva maneuver, and avoid crunches, twisting, plank. Third is pelvic floor dysfunction. It is a weakness or dysfunction of the pelvic floor muscles, which there are 14 of them, and it often causes urinary incontinence or this feeling like of heaviness in your pelvic region. To manage or prevent it, full range pelvic floor activation. So you don't just want that tightening or strengthening, you want the ability to lengthen and relax as well, and not just a Kegel. All 4 points of connection to your pelvis. Neutral alignment, core strength. You're gonna hear that for a lot of these. Also focus on breathing techniques that manage the pressure in your pelvic region. So avoiding breath holding, avoiding sucking in. It increases your intra-abdominal pressure. It's unnecessary. You don't wanna feel that chronic bracing. And if symptoms persist, like leakage, incontinence, heaviness, you can always refer out, talk to a medical professional. Number 4, your SI joint, sacroiliac joint dysfunction. So it's pain in the back of your pelvis, often worsened with unilateral movement. So one leg at a time, walking, climbing stairs, single leg weight bearing exercises like a single leg deadlift or a lunge. To manage or prevent SI joint dysfunction and pain, it's important, yes, core strength, neutral alignment, but it's also important to emphasize bilateral strength moves if you're working out. Bilateral means your legs are doing the same thing. So a squat, right? Your legs are doing the same thing, they're in the same position. It's also important to strengthen your glutes and consider pelvic support belts. I always recommend belts only if you need it because you want your core to be able to be trained how to support your growing belly. Avoid lunges, step-ups, any single leg exercises, deep stretches like a pigeon pose or sitting cross-legged, and any high-impact jumping, bouncing movements until SI joint improves. Number 5, sciatica. Radiating pain, tingling. It can go all the way down, like from your hip area, hip region to your ankle. It can be very uncomfortable and painful, and it's often caused by spinal misalignment or piriformis, which is deep in here, in your glutes, tightness. So my husband was knocked out for a week with this. It often is caused by extended periods of sitting. So what can you do? Strengthen your glutes, improve your posture and alignment, gentle glute and hip mobility work, gentle stretches to relieve pressure, cat-cow, cradle stretches, right? Anything that kind of open up through your hips. And like I said, avoid extended periods of sitting or slouching. If you're sitting for a long period of time, stand up, do a few squats, do some side leg raises, and then avoid anything that obviously aggravates it or causes the tingling to worsen or to start. And if you feel like this is persisting, reach out to a medical professional or a physical therapist. Number 6, Symphysis pubis dysfunction. What is that? There is a joint. There's an area between your two sides of the pelvis, and there can be inflammation. So you often, if you have this, it's pain in the front of your pelvis at the pubic symphysis joint area, and it often is acute, sharp, or wrenching. It's in the center and in the front. It can be very painful. To manage or prevent it, avoid unilateral, right? That's one leg, a high impact exercise and moves. Strengthen your glutes, improve pelvic stability, and maintain what? Neutral alignment and core strength, right? So you don't want to be like lifting one leg out. You don't want to be doing anything that kind of separates it. So no lunges, right? That's unilateral. Step ups, anything that is an abduction, abduction that lifts your legs, separates your legs. Avoid deep leg, single leg stretches, and avoid crossing your legs while seated. Any sudden twisting or pulling motions, it can all aggravate it. So we avoid those. Number 7, round ligament pain, very common. You have a round ligament that comes from here to your uterus. So if there's pain, it can be quick, sharp, acute pains in the belly or groin, especially with sudden movement, but sometimes, like for me, it was pretty low grade and chronic as your belly expands. Managing or prevention, moving slowly when changing positions, like getting out of bed, using that bedroll, getting up slowly, maintaining alignment and control throughout your movements, and you can always use a belly band for lower belly support if you need, right? You want to train your core and your body to sustain that extra weight on its own unless you need. Avoid jerky or fast transitions, like I said, like getting out of the bed, getting out of the car, nothing that's too quick. Sneezing or coughing without bracing or hinging can really bother it and aggravate it. So, achoo, right? That's going to help not have that big pull. Avoid high impact movements and anything that increases strain. And then we have carpal tunnel syndrome. Numbness or tingling in the hands and wrists due to the nerve compression right here. Swelling, it can be from swelling or poor alignment. Often you see this in postpartum mothers, but it can happen during pregnancy. Managing or preventing it involves focusing on posture, especially this upper part, right, the head and the neck. Often we're here, especially from looking at screens. Encouraging hydration, right? Remember to drink water, and any movement that would reduce swelling. You can use bands or modify hand position during exercises. So like planks, anything that's weight bearing on your wrists, where your wrists are flexed, that can be very painful. So you can hold dumbbells and do a plank. You can do elbow. Anything weight bearing on the wrist can aggravate it. And so can repetitive motions that aggravate this area, right? Any inflammation right here. Don't ignore numbness or tingling. Refer out if that pain is persistent. So those are what I think is the top 8 complaints during pregnancy, how to manage it, how to prevent it. If you have any other questions, reach out.